We need everybody to bring their A game right now because today we're reporting the highest Monday that we've ever reported. In fact, the last 7 days, 5 of them were the highest that we've ever had on that given day. Remember, Mondays, not as many labs are working over the weekend, typically much lower numbers. Today we're reporting 1,032 new positive cases of COVID-19. Brings our total cases to 109,670. How quickly we've gone from 100,000 to almost 110,000. Our positivity rate, now 6.25%. That's the highest since June the 1st. And remember, those in the red zone, we need you. We need you to be following the recommendations. You know, right now, our school system recommendations are just recommendations, we say, as long as the rate is below 6%. Well, we don't think that we'll have to change from recommendations if we see the vast majority, again, of business, of government, of school systems, and others actually following the advice. Because if you don't, the spread continues. It gets amplified. Currently hospitalized, 988 Kentuckians. Currently in the ICU fighting for their lives, 270. We have 142 Kentuckians currently on a ventilator. New cases by county: Jefferson 200, Fayette 147, Warren 31, McCracken 30, Kenton 29, Bullitt 28, Boone 24, Floyd, Hardin, and Whitley 22, Davis 21, Hopkins 19, Callaway 16, Campbell 15, 12 for Carter, Graves, Madison, Mercer, and Shelby, 11 in Hart and Pike, and 10 in Boyle, Jackson, and Lewis. Today, we've also lost an additional 3 Kentuckians to bring our total up to 1,470 Kentuckians. They include an 82-year-old man from Hardin County, a 93-year-old man from Jessamine County, and a 59-year-old man, a healthcare worker from Whitley County. We're going to be reaching out to that family to see if they'll allow us to talk about his incredible work and story that maybe would help other people recognize, again, what we are dealing with. Let's light our homes up green. Let's ring our bells at 10 a.m. 1,492 Kentuckians lost. You know, early on in the pandemic, estimates were even so much higher than that. But then when we had everybody, you know, really in this together, and we can get there again, oh, they shrank way below this. So what we're seeing right now is avoidable death. So think about that when you hear about somebody that you know losing somebody important to them, that what we're dealing with right now is avoidable loss. Long-term care facilities where so much of this loss occurs, 57 new residents, 39 new staff testing positive, 26 of the deaths we've recorded now fall into this category, an additional 26, 6 additional facilities. We're going to be providing an update on especially the amount of testing that we're doing in the facilities right now. But I don't want to sugarcoat it. If we have a red county, we try really hard, but we can't stop the virus from getting in. If community spread is so high, it gets into school, it gets into the long-term care facility, it gets in everywhere. That's why if we don't follow the red zone recommendations, county would just be lucky to come out of it. And dealing with the virus, I wouldn't want to bet on luck. There's a coordinated response that we ought to want to do. Kentucky child care facilities, 353 facilities now have at least one case. There's 9 additional ones. 7 new staff have tested positive, 5 new children.